And it's another beautiful day in the neighborhood. Jumbo Love, RadioNext.tv. All community, all the time. As I mentioned, it's more than a tagline. And I am getting so excited because this beautiful queen that you see on the screen with me, Dr. Anna Krute, with Dreamland Health and Wellness. And I think that we have been covering tracks in pretty much every area that people need to know about healthy sleep and how it affects your health. Dr. Anna Krute, hello, and how are you today?
Hi, good morning. I'm doing well. How are you, Harold?
Buzz of RadioNext.tv because I told you, so many people who did not understand how
Mhm.
important healthy sleep, some of the things that you knew to be able to obtain a healthy sleep pattern, they didn't understand, Doc. And, we're coming in now and we're making some clarifications. And HB talks a lot of stuff, but when the doctor backs it up, we're better for it.
Very nice.
Good, good. Today, as we do each and every week, we come in very authentic and organic about the topics that we're going to talk about. And I started thinking about sleep, and I said, much like we have different flavors in ice cream, much like we have different flavors in the meals that we might want to eat, we also have different flavors of people. And sleep probably has a direct correlation between demographics, men and women, ages of the people that are needing a healthy sleep, and they're probably a little bit different in every dynamic that we speak. Would you say that is true?
That is correct, Harold. Very true.
So,
Yes.
so last week, the one thing that we discovered, Dr. Nakute, was the fact that once we become adolescents and we are able to gain our own power of how we want to stay awake, how we want to create sleep patterns, the parent, after modeling these examples, are pretty much lost. And then we know as people grow older, their habits become formed to who they are. Let's talk about different spectrums of sleep and the different demographics of people. I know that we are going to be delicate about this because I was telling you, I deal with all, no, I deal with all spectrums of the community, and I deal with some people who are really stressed out because they're trying to deal with how are they going to make it from meal to meal. Then
Right.
I'm dealing with a spectrum of the community that is living week to week. I'm living with a spectrum of the community who things are just okay and all is well. And I'm sure that that has a very distinct uh, manner in which their healthy sleeping is affected.
Mhm.
More stress, less sleep, probably, correct?
Yes.
So let's start there. Let's start there when we start talking about people who might be on the lower income level and some of the stresses that they're dealing with day to day that might affect their sleeping habits. Working 2 to 3 jobs, having to take care of kids who are going to 3 to 4 different schools. All these things are relative, and that's the reason we're being candid about it.
Yes, and that is really true. What we find is that people that have a lower income level are more likely to take on more jobs, more hours, just to meet up with the needs. And that impacts negatively on their sleep because most of the times they don't get enough time to sleep. And so they're dealing with less sleep hours. And if they're having sleep issues like snoring, then less likely to look into it because they have not seen the need to pay to go see a physician to talk about this, right? Especially if they have no insurance and things like that. So, more likely, they neglect sleep time, sleep disorders. And so, we find that there is a very high rate, high prevalence of sleep disorders, including inadequate sleep hygiene in this population. People with higher income are more aware of their health and want to take care of their health issues. And so they're typically looking to sleep for at least 7 hours, looking to prioritize issues when they come up. So we've seen this quite a lot.
I want to say this, and this is just one man's opinion. This is not medical or board certified. I think a lot of, no, I'm just saying, I think a lot of the times that the things that we're addressing as I continue to listen, the insurances, if we're going to have proper insurance, need to make sure if sleeping is so healthy, that now healthy sleeping is included in the insurances so people will understand, be able to get this information, and know the effects of not having a healthy night's sleep. Your children not having a healthy night's sleep is so important. But as we mentioned earlier in previous discussions, they do not make this a priority. And it is one of the, like I say, after breathing and drinking water, sleep is probably the next component to living a healthy life. And I
Yes.
think that we do not do a good enough job of presenting this to people in certain economic levels to let them know how important this could be to their healthy life.
Yes. Yes. I agree. Absolutely.
Okay. Now we're gonna get off that because you wanted to be delicate, and so we were delicate, and I think we did a good job of addressing that. But we have some other things that affect us as a population of people. We have age, we have your social setting, we have your stimuli during the day. As I mentioned, Mr. High Pressure Type A personality, it's hard for me to wind down.
Yes.
Thinking nothing. It doesn't exist to me. I'm always thinking something. So let's talk about the differences in the different types of personalities of people, what they do during the course of their day, and how to unwind to get a healthy sleep.
Yes. And people that work in really high stress environments or have a very stressful job, most of the time have problems related to insomnia. And this is because, and I'm coming to the type A personality, right? But this
Yeah.
is more, this is more about work environment, stresses around work, not just work, family, right? If you have lots of kids, it's a lot of responsibility. And so you're taking care of your kids, and more so if you're homeschooling children, right? It is very stressful on the women. And so I see that these groups of people have a lot to deal with when it comes to sleep because they typically take their sleep time to worry about life, worry about their work, worry about their productivity the next day. Students worrying about exams and tests and all of that, especially if they're really in a difficult or in a challenging course like medicine. um,
Speak on it, doctor.
yes. And so that affects their sleep and such that when they should be sleeping, it's so difficult to wind down. And then coming over to personality types, if you're really someone who is so organized, you're like go, go, go kind of a person, even when it's time to sleep, your mind is racing. And I get that a lot. My patients are like, oh my goodness, I can't just seem to shut my brain off because it's racing throughout the wind down period. Even when they wake up in the middle of the night, it is a problem. And again, what I find in this group of people, once they have a really bad night of sleep, they feel like they've lost control because all they know in life is to gain control over everything around them. And in their minds, sleep should be the least difficult thing to get a handle of. And so when they have a difficult night, then they begin to stress over it. And that even worsens insomnia. And so finding out that your work, your family stressors, things around can really influence your sleep, and calling out these things and say, I think this is really what's happening. I think I need to take care of it is really very helpful.
Boy, you always open my mind up to more questions. And as I was sitting and listening, you laugh at me all the time. And for the listening audience and for the people watching, this sister and I, we're getting to know one another as you're getting to know about sleep. And I'm pretty interesting to Dr. Anakute, I can tell. But anyway, anyway, Doc, I'm thinking about that, and then I have met some sisters that just want to sleep all day. Let's talk about the adverse situation of too much sleep.
Right.
Go ahead.
Yes. So there has actually been a link to cardiovascular issues with long hours of sleep. And that's why we have a range of sleep time. 7 to 9 hours is really what we recommend. And so anyone who is telling me that oh, I need 10, 11, 12 hours, there's a problem. There
Mhm.
is a disorder of hypersomnolence, and there's a spectrum of all of them. Something is going on, or they have sleep apnea that is not treated, and they don't feel refreshed after 7 to 9 hours, so they're looking for more hours of sleep to help them. So there's always a reason for long hours of sleep. It's not natural. It is also not benign because, like I said, there has been associated cardiovascular risk to sleeping for longer hours than necessary. Another thing that is like it, I would say a cousin to it, is spending multiple hours in bed. Maybe not just sleeping, but just sitting in the bed for hours. Whenever I take history, I ask, how many hours of sleep do you get? And how much time are you spending in bed? So these people are probably sleeping for 7 to 9 hours, but then they're
Mhm.
spending 14, 15 hours on
Wow.
their bed doing other things.
And
Um,
we know that the bed is only for two things.
Yes. And yes, we've said that a lot of times. It is only for sex and sleep. And so when I find this, the questions that go through my mind, I'm asking, is this person depressed? Why do
There
you
you
have
go.
to stay in your bed for so long? Because we expect people to be up and about doing things. What is going on in terms of their lack of mobility, which can predispose them to obesity, right? If they're not as active as they should be, then they're at risk of gaining more weight. So those are the things I begin to look into and want to address in those groups of people.
I love this. I love this because a lot of the times, people are depressed and they have anxiety and they're not aware of it and they just pacify it. As you mentioned, with staying in their room, staying in their bed 14 hours a day, not realizing this is another issue that you need to address. As we close it up today, Dr. Anakute, and I just thank you again for always bringing this candid and not only candid, but professional perspective on sleep. We're going to end it up today with men and women. Or is there a difference? Should we not be, I guess, afraid to understand that there are two different biological chemistries working between men and women, and we might have different sleep patterns without, sounding like, I mean, because, everybody want to make something out of something. And I'm just saying that we are two biologically created different individuals.
Yes, yes, rightly said. I think we've touched on this a little, but I'm going to summarize what we talked about. So, men, again, would be the snorers earlier on.
I don't know about you, but I've had some beautiful little women lay next to me that snore like Otis the drunk off Andy Griffith.
That
I'm
is
just gonna say.
that is true. But in the 40s, the early 40s, mid and early 50s, we're talking about the men doing a lot more of the snoring. The women at that time will be struggling with insomnia. And then as they get older, the women to the 60s, then snoring catches up with that of the men. And so both men and women are snoring. I actually had a couple of a patient, a man, initially came, oh, I snore. I think I need to bring my wife. And a few days later, the wife came in and they're both in their 60s, right? So that is the age where snoring is about the
Becomes a
same.
competition.
Yes. And so both parties do not really care anymore because they can't even hear themselves snoring. Men do not typically complain about insomnia, difficulty falling asleep, staying asleep. Um, except so much is going on. They're dealing with some life stressors, and there's really something that is going on. But women are more likely to bother about that because they have so much going on, and that's just the way they're wired. Women are the warriors, the thinkers, and that always impacts on their slaves. So I would say those are the main differences between men and women.
I think all I can do is close this up and saying I love you, Queens, for taking on all this pressure in life. So men can just snore and be happy.
Yes.
How about
Yes.
no, but as always, we want to thank you for your candid conversation, your professional information that you're giving to the people about healthy sleep and how important it is. Dr. Anakute and her husband with Dreamland Health and Wellness right here live at www.radio-next.tv, giving you inside information on how you can better prepare your sleep. If you want to find out more about them, go to dreamlandhealth.com, or as I mentioned, you can go right to our radionext.tv page and hit the link and go there. Dr. Anakute, thank you so much.
Thank you, Harold. Always a pleasure.
Absolutely. All righty. Thank you.